gunk that's been sitting in their hair for hours, sometimes hours and hours if their temperature hasn't been good, they haven't done a bath yet. And you're just gonna scrub around and really stimulate that scalp and get those old scales off. You don't want the baby to get, and explain to the mom about the importance of scrubbing. You don't want to scrub till it's raw, but just to stimulate that scalp so they don't get cradle cap. And then you can put the baby's head under the water, not all the way, but just right in here and kind of, use your judgment. Don't drown the baby. If you don't trust yourself, do it in here and do it like that.
Only if the baby's crying.
Yeah. And sometimes they like that. Their head's under the warm water. They really just kind of calm down, and you're just kind of, doesn't it feel good when people do that to you? You get your hair washed, and you can do that.
Show them how to use that football hold, because that's a really good way
This
for
is
them.
a football hold. Think about when you're doing, and they use it for nursing too, if you're like that. Or you can do this hold. What are the other holds? There's the side lying.
Yeah. Whatever works for them. Yeah. Whatever works.
Anyways, whatever works.
But
this is the football hold. Okay. So, and then you also want to explain to the mom how to do the bulb syringe. This is something you might want to do before you get started. But you squeeze this in, put it up to their nostril, and then you just let it go, and it just sucks it out. And then you usually have like a tissue or a washcloth or something, squeeze it out onto there, do the other side. You can, a lot of the times we'll do it if the baby starts to spit up, kind of turn the baby to the side and let it pool in that little buccal space there in their cheek, and you put it in the side. Don't go straight back because you'll gag them even more, but just to the side, and then suck it out, and then do that, and do it till it's clear. And then I think the best way of cleaning these, you can just use hot water, boiling water, but just put it in the water, squeeze up, in, out, in, out, in, and they'll get in there and shake around and clean it out. Because they get kind of gross too, so. Okay, and then we would put on a new t-shirt. And that's always fun to watch too. That's torture. But anyway, so I'm not going to do it. But these little tiny, skinny little t-shirts, you can get their head in there and their arms, and students have their gloves and they're sweating and they can't get anything on. So anyways,
I feel like you're breaking the baby.
I step it in there to help.
You're not breaking the baby.
You're
They're
not
very flexible.
You're not. They are flexible. You don't want to wrench on them, but they are flexible. And you just figure it out. And so you get them into these tiny little t-shirts. And then teach the mom that the baby should have usually one more layer than what the mom would have on to keep them warm, to keep their temperature good. You don't want to overheat them. Seems like a lot of the times, sometimes with Hispanics, they'll put on lots of clothes and these big fuzzy blankets that they all kind of buy, or not they all, but that didn't sound right. But it's very common.
A lot of them do.
A lot of them do. In California, that's all they had. I remember I had a baby in there. I got like 3 of these huge fuzzy blankets that were all the same for my
By the
friends.
time you dig down and find the baby, it's
is
that one in there?
Well, and then explain to them the risk of SIDS. Really, they should not use a bunch of extra blankets, and the best thing to use are these halo sleep sacks, and that are proven to decrease the incidence of SIDS. And they're just like a sack that you put the baby in, and it zips up, and then it has like a little Velcro like this, and swaddles them. And we have those at the hospital. And it kind of depends on it. The parents are not supposed to take them home. They do. They're not supposed to. So usually we try to, hopefully you can find a sleep sack for the baby. And then I'll show you how to, you can show the parent how to swaddle if they are going to use loose blankets. So you just put the baby up like this, and then you learn to do a lot of one-handed stuff when you have a baby. Cook one-handed. Well, you shouldn't cook. And you can also tell them, don't lean over boiling water. But you do things one-handed.
You do what you do.
You do what you do. You do what you do to survive.
There are no rules.
You try to survive.
You do what you have.
You try to survive.
You learn to do a lot while you're nursing, too.
I was in school while I had 2 babies, so I used the boppy, and I nursed, and I was on the computer doing typing papers.
You learn to do a lot while you're...
That was not fun. Okay, so you make it a diamond shape and fold down the top, and that's where the head's going to go. And then you just lay that down, and then we put their baby down. And have it just go kind of above their shoulders. You're going to take one side and pull it across and to tuck that shoulder in. But babies, their only real comfort, other than mom and their boobs, are their hands. So they like to suck on their hands, have them by, that's what they like. Some people believe in swaddling down straight like this. I'm not that person. So let them have their hands, I say. And
Well,
then
they've had them for 9 months.
they
Why-
have
why
had
are
them
we
for
gonna take it away
but
from
you
them?
see people that
Exactly.
you see nurses going there, and they're stuffed like little mummies.
Oh, they're used to.
Yeah, give them their hands for
The
comfort.
resource nurse swaddles a baby tighter than I've ever seen anybody swaddle, and she has the hands down,
Hands
and
down?
they are this little package.
And I know they say it
And-
works, but I don't like
Yeah,
it.
I don't swaddle, but if you're with Heather,
She
does
does that.
Just swaddle them the way Heather swaddles.
Yeah.
Native women will do that too. Native
Yeah,
women.
yeah, they do. And I'm sure there's reasons it works too. It's just not my preference. So you pull one side across, take the bottom, pull it up. There's always a little extra. Don't leave it over the head. Just fold it down nice and neat. And I love to wrap packages, and that's kind of what this is like. So then take the other side and pull it across, and then just tuck it in, and then they're a nice, neat little package.
They're
I have a
nicely Burrito
friend
wrapped.
who used to duct tape.
Are you kidding?
No, I'm not. She was a nurse too. Well, she would just duct tape. It was like using Velcro. You know, just duct tape.
Oh, I don't know.
I don't know about that.
I don't know.
I'm
Like,
not
you
sure
just
about duct
put a
tape.
little duct tape to keep the blanket stuck, but don't teach them.
I'm not so sure about duct tape.
That's an example. So anyways, so then that's it.
What if it's like the pattern duct tape?
You don't really, oh,
Pat
that'd
would
be a
make it
riot
look
now.
cute.
There's some really fun duct
They would
tapes out
just
there.
do it because when the baby would become unswaddled, they get, and that would just, it's basically like how the ones have the Velcro on them, the sleep sacks have Velcro. Which I think those sleep sacks are great. But we didn't have them when I had babies.
Yeah, I think they're great.
You know what? I don't know because they were running out of them, so if they replaced them, they're, it's not a cheap thing and people
they
were
get
taking them
stuck.
home. So,
If you know somebody having a baby, you can buy sleep
that's
sacks
what I did. I
all
bought
over
them
the
in
place.
sleep
Get them a
sacks.
sleep sack for a
Yeah.
gift.
Yeah.
But,
So,
yeah.
any questions, anything?
They just didn't like them.
They didn't like the sleep sacks? They are, like,
In the Des
in
Moines
studies,
hospital,
they are
they
shown
didn't
to
like them.
decrease the incidence of sleep.
Yeah.
Kids didn't like them. They didn't like them. And they sent them home with them. Everybody.
Oh, did they?
Really?
My friend just had twins and I bought
Yeah,
them, and
Mercy
she went and
sent
bought
some.
more. She loved them.
Oh, yeah, I use them
Yeah.
with my kids.
Yeah.
I was so scared to have a blanket in the crib.
Well, yeah, because they come loose and then they get over their faces.
Yeah.
And-
Yeah.
I got them.
Any questions about that? So that's basically what your video is gonna be like, only you're gonna go into a little more detail about your education topics and stuff. I just didn't go into all that. And you can put lotion on. I mean, we usually don't. In the hospital, actually put lotion on. They're usually not a problem with dry skin quite then, but you can. Just make sure it's not perfumed. What?
Do you do anything with fingernails?